Welcome everyone to our channel, Today in Psychology. Are you ready to delve deeper into the complexities of the human mind? Our ABCs of Psychology series is here to do just that. Each video in the series focuses on a different topic within psychology, and today's video is no different. In today's video, we will be discussing various aspects of identity disorders as it relates to psychology. We'll explore the different types of identity disorders, such as borderline personality disorder, dissociative identity disorder, narcissistic personality disorder, antisocial personality disorder, obsessive-compulsive personality disorder, and more. We'll also discuss the causes, symptoms, and treatments of these disorders. To make the material more relatable and engaging, we will also present you with several case studies throughout the video that will help illustrate different concepts and help you understand how these disorders can affect people's lives. Whether you're a psychology student, a therapist, or just someone who is curious about identity disorders, this video is for you. So, sit back, relax, and let's explore the world of identity disorders together. And we begin with borderline personality disorder. One of the most well-known identity disorders is borderline personality disorder. Borderline personality disorder is characterized by a pattern of unstable and intense interpersonal relationships, self-image, and moods, often leading to impulsive and self-destructive behavior. People with borderline personality disorder may experience intense episodes of anger, depression, and anxiety and can have difficulty regulating their emotions. To better illustrate this concept, let's take a look at Sarah. Sarah has been diagnosed with borderline personality disorder and has struggled with intense and unstable relationships throughout her life. She often experiences intense episodes of anger and anxiety and has a hard time regulating her emotions. She finds it difficult to maintain friendships and romantic relationships due to her impulsivity and tendency to self-sabotage. Despite her struggles, Sarah is currently in therapy and is working on learning how to manage her emotions and improve her relationships. Her case exemplifies how borderline personality disorder can affect one's life and relationships. As Sarah's therapist, there are several things that can be done to help her manage her borderline personality disorder. Borderline personality disorder treatments. Provide a safe and supportive environment. By creating a safe and supportive therapeutic environment, Sarah will be able to feel comfortable discussing her thoughts, feelings, and experiences. Use evidence-based treatment. There are several evidence-based treatments that are effective in helping individuals with borderline personality disorder. These include dialectical behavior therapy, DBT, and cognitive behavioral therapy, CBT, which focus on helping individuals regulate their emotions and improve their relationships. Help her understand her disorder. By educating Sarah about her disorder, her therapist can help her understand her symptoms and how they affect her life. This can be empowering and help her take control of her symptoms. Help her set realistic goals. By working with Sarah to set realistic goals, her therapist can help her focus on making progress and achieving positive outcomes. Encourage self-care. People with borderline personality disorder can be at risk of self-harm. Encourage Sarah to engage in self-care activities such as exercise, meditation, and journaling to help her cope with her emotions. Address any co-occurring disorders. Borderline personality disorder often co-occurs with other disorders such as depression, anxiety, or substance abuse. Her therapist should address these other issues as well in order to provide a more comprehensive treatment. Help her work on her interpersonal relationship. People with borderline personality disorder often have difficulty in sustaining healthy relationships. Her therapist can help her work on her communication and conflict resolution skills, and help her understand the underlying reasons for her difficulties. It's important to remember that each person's experience with borderline personality disorder is unique and the treatment plan should be tailored to the individual's needs. Dissociative identity disorder. Another identity disorder that is widely recognized is dissociative identity disorder, formerly known as multiple personality disorder. This disorder is characterized by the presence of two or more distinct identities or personality states that alternate in controlling the person's behavior. People with this disorder may have gaps in their memory and have difficulty recalling important personal information. To better illustrate this concept, let's take a look at Jack. Jack has been diagnosed with dissociative identity disorder and has been struggling with memory lapses and gaps in his past. He has several different identities or personalities, each with their own distinct characteristics and memories. He has a hard time recalling important personal information and has difficulty integrating these different identities. Despite his struggles, Jack is currently in therapy and is working on integrating his different identities and improving his memory. His case exemplifies how dissociative identity disorder can affect one's memory and ability to recall important personal information. Narcissistic personality disorder, NPD, is a mental condition characterized by an excessive sense of self-importance, a need for constant admiration, and a lack of empathy for others. People with NPD tend to believe they are superior to others and have a strong sense of entitlement. They also tend to exploit or manipulate others for their own gain. The diagnostic criteria for NPD as defined in the DSM-5 include having a grandiose sense of self-importance, a preoccupation with fantasies of power, success, brilliance, beauty or ideal love, and a lack of empathy. The causes of NPD are not fully understood, but research suggests it may be a combination of genetic, environmental, and psychological factors. These include childhood experiences such as emotional abuse, neglect, or a lack of emotional warmth and imbalances in brain chemicals. A proper diagnosis should be made by a mental health professional. A case study in narcissistic personality disorder. Meet John, a 30-year-old man who has been diagnosed with narcissistic personality disorder, NPD. John has always had an inflated sense of self-importance and believes that he is superior to others. He is often dismissive of others' opinions and feelings and struggles to maintain healthy relationships. He is known to exploit others for his own gain and has a hard time understanding or caring about others' feelings and needs. John's co-workers find it difficult to work with him as he is not a team player and often takes credit for others' work. His family and friends also struggle with his attitude and behavior. He has been in several short-term relationships, as his partners find it hard to put up with his lack of empathy and constant need for admiration. John has decided to seek help and is currently in therapy, working on understanding the underlying causes of his disorder and developing healthier ways of thinking and behaving. He is also taking medication to help him manage symptoms of depression and anxiety that often accompany NPD. John's case illustrates how NPD can affect an individual's relationships, work, and overall well-being. It also shows how therapy and medication can be helpful in managing the symptoms of NPD, but it's important to remember that NPD is a complex disorder that requires a long-term, comprehensive treatment plan and is not easy to cure. Narcissistic personality disorder treatment. The treatment for narcissistic personality disorder, NPD, mainly consists of psychotherapy or talk therapy. The most commonly used form of therapy for NPD is cognitive behavioral therapy, CBT, which helps individuals identify and change negative patterns of thought and behavior. Other forms of therapy that may be used include psychoanalytic therapy, which helps individuals understand the underlying psychological causes of their disorder, and schema-focused therapy, which addresses negative patterns of thought and behavior that have developed over time. Medications such as antidepressants can also be used to alleviate symptoms of depression and anxiety that often accompany NPD, but it is not the primary treatment and should be used in conjunction with psychotherapy. In conclusion, we hope that this video has provided you with a deeper understanding of the different types of identity disorders and their associated symptoms. We have discussed borderline personality disorder and dissociative identity disorder. We have also discussed the various treatment options available for these disorders. We would like to thank you for taking the time to watch our video and hope that you have found it informative and engaging. We encourage you to like and subscribe to our channel to stay updated on the next video in our ABCs of Psychology series. Remember that knowledge is power, and the more we understand about these conditions, the better equipped we will be to help those who are affected by them.